Welcome to Building Bridges. I'm Taylor Thomas, and today I'm joined by Haley Hatfield to discuss collaboration between ABA and occupational therapy. Enjoy the episode. I'm Taylor Thomas, and I am the Functional Assessment Director, and I'm here with Haley. Go ahead, Haley.
I'm Haley Hatfield, and I am the Professional Development Advisor here at Hopebridge. And today we will be discussing the collaboration between ABA and OT. All right, Taylor, let's get started with some of the questions that we have today. So in your experience, how has interdisciplinary collaboration evolved in the pediatric therapy industry?
Yeah, that's a great question. It's hard for me to say how it's evolved because I started in one of our centers where we had OT, PT, and speech. So, from my experience, the entire time I've been in this field, I've got to experience what that full collaboration looked like, right? So, I came in as an ABA therapist and was automatically working with our SLPs and our PTs and our OTs in the center. I would say though that it has expanded into, I'm hearing more people be able to do that. A lot of other centers like pediatric providers don't necessarily have that on-site collaboration. And so them learning how to collaborate has been a process. And as they come to Hopebridge, I am asking questions when I meet with clinicians, like, have you checked with the OT about that? And they're like, no, I didn't think about that. But so starting to work with clinicians on thinking of them as a resource that's in center and available, or reaching out to them for, the SLPs as far as a modality of speech and how we can work together to establish that. I've just seen clinicians grow a little bit in their start to collaborate without a prompt, essentially. And even looking towards following those people on social media, right? So yeah, I follow this SLP. I'll hear people talk about that. I follow this SLP on social media, or I saw this video on TikTok of an OT. And so I think social media has kind of helped that as well. It gives us insight into what those other therapy sessions can look like, because we don't always get to go to those, right? I'm in a consult with my kiddo, or that kid's an OT. And so I'm thinking, oh, I can't go see them right now. So having access to kind of see into those sessions that pop up on social media, I think has really helped with that
Yeah.
evolution of collaboration as well.
Yeah, absolutely. I agree. I think we, you and I both share that experience, that unique experience that we came along early on, and that we've always had that team of an OT and a PT and speech and an ABA therapist. But I do think the dynamics of the team have really changed from those early days. And I think a lot of it has to just do with the growth of the profession too. You think back to when we started in ABA, it was early on, and the profession was still very new at that time. I mean, it maybe was 10 years old. So there weren't very many providers. And so I think back to my, early days as an OT, the BCBA wasn't on site with us every day, all day. And so we didn't really have a lot of those opportunities. They were always available, via phone call or email, but just to have those daily interactions, I think, we've come a really long way now, having centers that we have multiple BCBAs and the team is all there and present. And so I think that has also really changed the dynamic. I think too, when you came along, I don't think RBT wasn't a thing yet then either, was it, the credential?
Oh,
So
yeah.
when the BCBA was in the center, I mean, all of their time was spent around really working and training with that ABA therapist, because that was their only way to get training at the time. And so there just wasn't, always the time to check in with the other disciplines and kind of do all that, unfortunately. And, you mentioned social media, and I think that for sure, but also along the lines of technology in general. We go back to the ancient days where we had the note cards and the recipe boxes of where you were running ABA programs. And so it just took a lot of manpower for the BCBA, I think, to manage those programs early on. And, there wasn't any way for the OT. I mean, we would have to physically go in and pull the actual paper program to look at it. Whereas now we can do that electronically, and we can see the goals that they're working on for collaboration. But, I think that it just kind of fell to the bottom of the list because there was just so much more, it took so much more manpower because there were just so few BCBAs at the time.
Yeah, and I had actually forgotten about the fact that we didn't have BCBAs on site every day. So you're right. It was the ABA therapist just working directly with those OTs or, speechies that were on site. So I had completely forgotten about that. It's been such a long time. But yeah, that's a good call out. And I think too, one of the other things that I've seen kind of evolve over time is that in the past, we were so new to working together that some of our language differences really caused a barrier
Mhm.
between the disciplines. And I think we've done a really good job of merging, like you say this and I say this, but what we're actually talking about is the same thing. Or I used to hear a lot of, well, that's an OT thing. I'm not allowed to do that. And it's like, actually, it's functional play skills, or it's, we can incorporate that. And so now I'm seeing a lot more collaboration too with like just the language kind of merging so that we're able to kind of talk the same language and communicate better together.
Yeah, for sure. I think that has definitely helped. Um, which yeah, kind of leads us into I think our next question.
Yeah. So this one is, what are some misconceptions held between BCBAs and OTs, and how have they evolved over time?
Yeah, so you mentioned the language as being one of them and the terminology, and that I think has been a big misconception, and that we just didn't always understand that we were sometimes talking about the same things, we just called them differently. I think for me as an OT, looking at ABA sessions, there are times when early on, especially, it looked like we were just watching a lot of discrete trial training, and it looked like they were just running a bunch of trials, and we weren't really understanding what they were doing, and in understanding the framework that the ABA is based upon. And for BCBAs, I think then they were kind of looking at OT like, what goals are you really working on? You look like you're kind of just playing and you're letting the kids just pick what they want to do. And so really just understanding, I think, each other's um, frame of reference and our framework, and understanding how we are both usually working on the same things. We just our treatment sessions look very different from each other. But once we kind of understand that, then we can see where overall OT and ABA is very complementary of each other. Even though they look very different, they still complement each other, which is, just is always going to help the child and increase those outcomes.
Yeah, could not agree more. And I think too, partnering with your OTs on like even asking what goals they're working on. I know that seems like so simple, but just asking like, hey, what are you working right now on in that session? And to come to find out like we've been working on the same thing, or um maybe they're working on something that I was like, oh, I hadn't even thought about addressing that skill with them. And then we can kind of hit it from two different places is so helpful. And I feel like, kind of goes back to the last question, but that has kind of evolved over time too. Like, I want to know what you're working on. Like, what are your goals? I
Mhm.
think the other thing too, I know we're talking about misconceptions, but there's this big word of like behavior, right? And it's like
Yes,
ABA, we have to focus on behavior. And then with OT, speech, and PT, maladaptive behaviors can be a significant barrier to those sessions. And so
absolutely.
learning how we can support those OTs and those SLPs and PTs to reduce challenging behavior, because maybe you can kind of explain that to us a bit. But if that becomes too big of a barrier, what happens to those kiddos that are getting those services? Because it's different from what we would experience in ABA usually. So, can you walk me through that? Because I think that might be helpful for some of our BCBAs too.
Yeah, of course. And that's where, like, we love our BCBAs and their areas of expertise and helping with that. That was actually what kind of sparked my interest in even going back once I became an OT to go back and to become a BCBA as well, just for that knowledge of like, wow, like they're really able to work through that. And I was really having some hard challenges with like, as OTs, we come up with all these great ideas and we love to be creative and all these interventions. But when, the child comes in and they don't want to do that, you sometimes, and especially as an early clinician, you get stuck. Like, okay, now what? And I'm trying to pull out all these things, and they're having a maladaptive behavior, and so I got to figure out how to address that because we're never going to get to our goals if we don't address that root cause first. And so, really using the BCBAs to see like what is the function of their behavior, and you guys have always done a great job of being able to figure that out and explain, and then we can really dig down to okay, if this is the function of behavior, then how can we help meet those needs? Because if we can't get through that, then we're never going to be able to work on, increasing self care skills or fine motor skills. So, it's just so crucial, I think, to have that. Someone come in with the behavior lens to help us get through those barriers, because if not, then we're not able to really even make any impact in our treatment sessions.
Yeah. So it's not that like OTs don't want to deal with challenging behaviors. It's like if you are spending so much time dealing with those things that you can't get to your goals, then you could lose
Mhm.
that authorization, right? Or like you won't be able to bill for that. And so I think that kind of falls into those misconceptions sometimes, is that OTs don't want to work with challenging behaviors. It's not that at all, right? It's just like you guys have really specific outcome data to report on for what you did during that session. And if behaviors or maladaptive behaviors are causing a barrier to that, then you guys are at risk for like losing authorization for that kiddo.
Yeah,
So,
absolutely. And, as BCBAs, you guys are so good at analyzing, the behavior whereas like, well, we'll try this and we'll try that and we'll try this and we try all these things. And then when they don't work, it's like, I don't, now what?
yeah.
And so really having that lens of you guys coming in and going through a full functional analysis and determining that function of behavior just really will help us go so much further in our treatment sessions.
Yeah.
So Taylor, what advice would you give a parent just starting their journey with OT and ABA?
Oh, that's a good one. I think I would say like eat up every bit of time that they're going to give you. So, I'm a pretty nosy parent, and I would say that I would probably advise any parent with kiddo in treatment to be a nosy parent too and ask, like, what are the goals that they're working on this week? What things can I work on in the home? What
Mhm.
information do you need from me? Are you having any barriers? And start asking some of those questions because, it could very much be that like kiddo's not eating their lunch and then they're tired the rest of the day. And I have to say, oh, you have to warm it up just like this. Or they actually will only drink it if you fill it up 20% juice and 80% water, like little things like that. Or same thing with like, let's say that they, the OT created some goals for them. And I say, oh, well, at home, they can actually already do that. So I wonder if, kiddo didn't, just wasn't compliant during that time or whatever. So I would say just like communicate as much as you possibly can with your BCBA and with your OT, and find a system of communication that works for you. That way you can, what's going on and how to implement those things. Cause that's, as clinician, like that's our goal, right? Is that everything that that kiddo learns in our center, we don't just want them to be successful here. We want them to take that home into school and a grandparent's house. And so we really need parent buy-in, to implement those things because that's the whole point, right? Like we need them to be able to
Yeah.
do those things at home. So that would be my biggest thing is like get nosy, get involved, find out, communicate with your BCBA and OT about what's going on and what their barriers are so that we can all work together. What would you say
Yeah.
for that one?
Absolutely. I think right aligned with that, like, you are as a parent, you are the expert in your child. And so don't forget that. And it's okay to ask a lot of questions. We try really hard not to use our professional terminology when we're speaking to parents, but it is kind of like our second language. And so it does sometimes slip out. And sometimes I forget, like, oh, I haven't even really explained that to a parent yet. So please, like, reach out and say, what did you mean when you said that you provided proprioceptive input to my child? And how did that help regulate them? Ask those questions, just as you were saying, so that you can understand and then we can get that carryover into home. And there's a lot of times where we'll see very different behaviors in the center versus in the home. And sometimes it's better and sometimes they're not. And so I think understanding that, sometimes we bring in the family and because they'll say, oh, they'll never do that at home. And then we bring them in and they're like, wow, I didn't know they could do all those things. And that's our whole goal is that we want them to be able, like you said, to do those in their natural environments. I think another big thing for parents is to really think about when you're talking about setting goals for your child, what is really meaningful and going to make the most impact on you and your family. I think sometimes we can get caught up in like, well, they can do this skill and they can do that skill. So then this would be the next skill that we would work on. But is that really going to make an impact for you or for your child? Take, let's say, shoe tying, for example. If your child is fine with the shoes that they're wearing and they don't want a different kind of shoe that does tie, or there's a lot of adaptive shoelaces now that are kind of like the zigzaggy ones that you don't have to tie, then maybe you don't want to spend your time and your effort working on shoe tying right now. Like maybe it would be more meaningful for you to work on sequencing tasks. So like it would be much more impactful for the child to, if the mom can lay out clothes and just say like get dressed in the morning and the child's able to sequence those steps and get dressed independently, that would be increasing their independence. It would give mom time to maybe pack lunches or whatever, she needs to do in the morning too. And so that may be more beneficial than, teaching them to tie their shoes right in the moment. So I think just always thinking about like, what are your barriers in the home and what would make the biggest impact when you look at setting your goals?
Yeah, I love that. And it goes right along with my thought process. And I say this all the time, but like I grew up in an autism home. So I didn't know any different. My older brother is autistic. And so I didn't realize until I moved out all of the modifications that we had kind of set up in our home just as an autism home, right? And so sometimes when I'm talking to parents and I'm asking them, questions on an assessment, their answer will be like, no, actually, that's not a problem at our house. And then I give examples of, for example, like Let's say, do you have to take the exact same route to therapy every single day? And what would happen if you took a different route to therapy? And they're like, oh, that would not be good. Like, okay, then that is it. If you can't stop and grab like a Starbucks on the way, or if you can't stop at the drugstore and pick up something that you need on the way to therapy, and you have to drop the kiddo off first because you can't alter your route, then that would be what a term we talked about terminology too, but it's like a mollification, right? So I think too, being honest with your clinicians, like you said, about the things that are really impactful to your family. And maybe you're more than happy to make those changes for your kiddo. And I think that's wonderful. But I also think about like sometimes that road is just going to be closed. And so you're going to
Yeah.
have to take a different route. And what happens when life happens, you know?
Right.
So I think like exactly what you were talking about, be honest about like, I need this kiddo to be able to do this. We need to be able to eat at other times of the night instead of just 6 o'clock or 6:03 exactly because life happens. And so we need to know those things as well in both disciplines so we can help prepare your child for when real life things happen, right?
Yeah, absolutely.
Okay, here's our next one. Tell me about a moment that proved the impact of interdisciplinary care.
Well, I do really love that question because that's really at the heart of what we do as clinicians and why we do what we do, is because we love to see that impact and we love to see that progress, and the increase in dependence for the child and the family. I think, honestly, I think if you take every day as a treating therapist, you can see those little moments in every single day. If that's what you're really looking for, when you have a really good, strong, cohesive team that's working together, you see how that is impacting the outcomes of the child in their everyday therapy sessions. But for those big moments that really kind of stand out to me, are always really around feeding. I think that, I think about a kiddo that I've worked with that's had very, very severe food aversions. And I wasn't going to be able to make a lot of progress in OT alone, doing that, for an hour session 1 or 2 times a week. But because I was able to work with a BCBA and because I was able to work with a speech therapist, we were able to come up with a comprehensive plan that could be carried out 5 days a week. And so we could use that time when they were there 5 days a week in ABA, to work on some of those desensitization strategies and, increasing textures, and not just with foods, but just with all kinds of different items at first, backing it way down where they were exposed to multiple things throughout their day, and building up to where then they were playing in foods, because this poor little kiddo, he was gagging anytime he would even just look at a food. And so, we had that exposure every day when they were in ABA. They were able to build that into their program to where then, that really made a huge impact when it came time to then presenting different foods and textures. And they were able to present those foods and textures during his lunchtime every day. And when they were coming in for ABA, and then speech came in and said, okay, we also have some oral motor weakness. And so how are we going to address that? And here's some exercises. And, ABA was able to add some of those into the program as imitation, just to work through strengthening those oral motor skills that will also help play into feeding. And so, and I think about then him being able to add additional foods into his diet and just really increase the nutrition that he, was receiving, was a huge impact on the family and that kiddo. But that I would not have been able to ever even come close to getting that as an OT by myself.
Yeah, that's a good like call out for like what's a barrier that OT would have. And it's like time with the kiddo. But then we have ABA services who we could have 35 hours a week opportunity. And so without that like cross collaboration, he would have only gotten like an hour a week of feeding therapy. So you're right. Like that's a great way to look at like a barrier from your perspective, but then like a strength in another discipline. Love it when we're able to make that work. When I was looking over these questions, I have like a one really specific awesome memory with this kiddo. And it was one of my like kiddos that engaged in really severe challenging behavior. And I was working with the SLP on um, language options, modality options. And I was working with, PECs and we were making very minimal progress. One or two vocal mans without, kind of without prompts. So we were able to trial the lamp device with this kiddo. And I still remember it vividly and I have a really bad memory. So it's just like, if this is how like impactful this moment was, I remember exactly where we were in the center. And I presented this lamp device and I modeled a couple of trials for him. And his face just lit up and he just started going to town. And so I opened it up for like full board. I was like, he just wants to explore. And he spent 10 to 15 minutes just looking at all the buttons. And he'd like look at me like, oh my gosh, I know that word. That's great. And he had it for like an hour a day for a couple of days. And then he came in one morning and it had been snowing and it wasn't snowing that day. And he came in and he was trying to talk to us about something and tell us, and we just didn't understand. He kept pointing at our center manager. And he finally got his device and he found the person and then he found shovel and he walked up to them and he put a whole sentence together of where's your shovel? And he was just like every day that week that person had been out there shoveling. And so he got there at therapy and he's like, "Where's your shovel today, dude?" And I was just like so proud of him, the fact that we just needed to find the right tool. And without working with our SLP and without being able to like trial this kiddo with an AAC device, he would
Mhm.
never have been able to tell us that. And it just like the way that it impacted his overall like affect throughout the day, he was so excited to get that device because he could finally communicate with us. And so I think like you're right, feeding is impactful. I think so many times about like AAC devices and those kinds of things that we can only get from working with our SLPs and just how life changing they are for our kiddos and the
Mhm.
families and everybody working with these kids.
Yeah, I agree. The when you unlock that communication piece for a child,
Yeah,
that is just it is it's amazing to witness and just to feel that you are making that impact for that child, that they have that all inside of them and they just didn't have a way to get that out and to give them that tool to be able to do that. You couldn't be more happier for the family and for the child when they're able to do that. Sometimes we'll have a child that will start to learn how to say like not now or I don't want to or whatever, and we celebrate those. We're like,
good for
that's
you.
so great because they're able to communicate to us right now that they don't like something and they don't want it, and they're able to, whether that's verbally or through a device. And so we do love to celebrate all of those moments. I think about the first time that a mom has come in and said, my child said love you, and just those simple words that they haven't ever got to hear before. But that just there's nothing really quite like those experiences when the child can start communicating and telling you things that they've always had inside and wanted to tell and just haven't been able to do that. Mm.
For
So, Taylor, tell me, what is one thing you wish every OT understood about your role and practice?
I think the fact that we have to figure out like motivation, we have to figure out what is causing this behavior to continue to happen, right? So we have motivation for something, we engage in a behavior, whether it be what we would deem as like good or negative behavior or challenging behavior. It's been serving a function for this kiddo, right? And so we have to replace that challenging behavior. And so we can set up antecedent strategies, and oftentimes we need to, but our goal is not to get this kiddo to a point where they just rely on antecedent strategies, right? We have to be able to replace those replace those challenging behaviors, usually or always with some kind of skill, whether the skill is like functional communication or the skill is some kind of contextually appropriate behavior, which is essentially like instead of engaging in throwing the toy at your head, I will play with the toy functionally because now I understand how to play with it, or I'll tolerate giving it back to you. And that's the contextually appropriate behavior, like when you ask it to. So and I haven't experienced, OTs that don't understand that process, but I think it takes a little bit of time to assess those challenging behaviors and then figure out what's motivating the child and what's reinforcing those behaviors, and the fact that it takes a lot of time. I mean, sometimes these kiddos have been reinforced with these challenging behaviors for 6 or 7 years because they haven't had another way to do it. So it takes a bit of time for us to kind of plug in. We need to implement this functional communication. Not we can't just rely on token boards or visual schedules to kind of solve the problems for our kiddos. And like I said, every OT that I've worked with has been really great about that, but it just takes us some time to figure out what tools are going to work with that kiddo. So that's probably the biggest thing I would say, is that sometimes we forget the process of like we have to assess first, and then we have to start with functional communication treatment, and then we have to build in contextually appropriate behavior. And really, before it can generalize, we have to master it within like a certain set of people first before that kiddo will start to show that into other spaces. So I think sometimes we can incorporate other things into OT, and other times we're like, hang on, just like another week, we can push it out into OT. Language is always like, yes, please use, their method of communication, which our OTs are always more than happy to do. But some of the other pieces we'll like hold on to a little bit because we want to make sure that it's really strong and that the protocol has been implemented really well before we try to, push that out to other providers. So that's the only thing I can think of is just like how systematized our process is
Mhm.
and, communicating where we are in that process. What are
Yeah.
your thoughts on that?
And I think, OTs, that's where we get, because you guys are so good at being systematic in your approach. And we are like, let's, OTs are doers and we're like, let's do this. And let's and we see that it works
Yeah.
and we want to keep doing it. And so sometimes patience is not our strong suit because we're like, well, it's working in ABA. It's like, let's do it, why are we doing it in OT too? And so, but I think once they understand that frame of reference that, we really want to make sure we have solid program in place so that we aren't doing it too soon and that we know exactly anything that could come up and how we are responding to those situations. And, before we try to generalize it into a different discipline and across a different person, because as we know, as soon as it switches sometimes to a different person, it goes kind of back to square one. And so that's, you got to have a strong foundation before you get ready to do that. And so just making sure that OTs understand that that's why they have to be patient and wait a little bit before it gets generalized across other disciplines.
Yes. I guess the only other thing that comes to mind here is like, um, we want to implement a lot of the OT recommendations for like, in your words, it would be some kind of like sensory input, right? But if we put the
Mhm.
words like sensory input on some of our notes, it's going to be like, heck no, that is not an ABA term. That's not something you can bill for. And so we have to get really strategic about like, I hear you and I definitely want to implement this in the session. I have to figure out how I can provide this for this kiddo and it align with our POC goals the same way that like OT and speech would have that same dilemma, right? And so I think sometimes too, it's not that I don't want to implement this, or sometimes it's like the OT says, you used this word earlier, you should provide proprioceptive input at this many minutes every hour. And our RBTs are like, that sounds great. I have no idea what that means because they
Mhm.
haven't been, in this field for a long time. So we'll have to, really break that down. Like, tell me exactly what that looks like and what do you mean? What are the activities I could implement? And I can get those added to rethink in that program. But it really has to go like clinician to clinician so that we can break it down and put it in our data collection systems and our programs so that it can be implemented and be considered like an approved ABA activity, right? How can we
Sure.
implement this with man trials? How can we implement this with some other things? So I think that would be the only other thing that comes to mind is like, again, we have to align with language and we have to align with what OTs are allowed to do and what ABAs are allowed to
Mhm.
do and how can we mix that and kind of work together and make sure that the kiddo is getting everything that they need, but that both disciplines are kind of staying within their scope
Mhm.
and making sure that it aligns with the hours that we requested for that kiddo, for that discipline.
Yeah, for sure. And that also kind of just got me thinking, how do you explain an FBA to an OT or a speech therapist? Because I know a lot of times OT and speech are like, well, you're trying to make them have a behavior. Like, why would you do that? We already think we know why they have that behavior. Like they do that when they get hungry or they do that when, they get overstimulated. And so how do you kind of explain that process to OTs and speech therapists?
Yeah. So an FBA or a functional behavior assessment is what we do or should do before we implement a behavior intervention, right? So in an FBA, we are trying to determine what turns this behavior on and also what turns this behavior off. And sometimes we have to wait until we get really strong answers. There are some things that we can do regardless of whether we have a really strong answer for that. But ultimately, it is part of our ethics code that we must be able to determine what is the root cause or the root reinforcer for these challenging behaviors before I ever try to change the behavior. So I have to understand it before I change it or try to change it. Now, obviously, that can get really tricky if I'm also trying to keep everybody safe, right? And I'm trying to
Mhm.
provide um, dignified services as always, right? We want any person to kind of walk in and say like, I'm proud of what I'm seeing, right? We want them to feel good about what they're seeing. But we will oftentimes, and we've changed this over time, and Haley, like this could be hour-long conversation with me about like how we've changed in our practices because 10 years ago, I would have told you I definitely don't want to do a functional assessment on a kiddo because of all the barriers associated to that. Today, I will tell you, like, yes, let's do a functional assessment. Let's do an ISCA. And that's a big, long acronym that basically says I can turn on really quick precursor behaviors. And it could be as subtle as like a kiddo putting their hand up to tell me to stop or them turning their body away. And I can reinforce that behavior at the precursor so that kiddo's never getting really upset. So we have better tools now. I can implement that assessment. We can be done in like 7 or 8 minutes, and I can continue writing that plan and finish it up. And then I'm ready to implement an intervention, right? So I think
Mhm.
like in explaining a functional behavior assessment, I have to be able to turn the behavior on. I have to be able to turn it off. And I need to be able to keep everybody safe and maintain a really good relationship with the child throughout that time. And once we've been able to do that, then I write a plan based on those results, right? So it does take some time, especially to do it well and to do it safely, which are our top priorities, that and maintaining dignity, and then obviously like maintaining that relationship with that child. But it does take time for us to be able to do that, and sometimes it's like multiple BCBAs getting together to design that specific assessment for that kiddo. But if we just jump right in and we start treating that challenging behavior without having done that assessment, for one, it's unethical, but for two, we're kind of just throwing the book at it, right? It would be like you going into a doctor's appointment and saying like, "Hey, my back hurts." And the doctor's like, "Okay, well, how about you do yoga? And then I want you to take 2 aspirin 2 times a day. And then I want you," and he gives you like 10 different things to do. And then you come back and you're like, "Hey, it's not any better." Or it is better. And he's like, "Okay, great. Just continue all 10 of those things now for the rest of your life
Mhm.
because your back no longer hurts," right? You don't know like what it was. Was it just the Advil? Was it the yoga? Like, what was it that fixed my back pain? And because we like threw the book at it and didn't really figure out what it was, now you don't know what to keep doing. Does that make sense?
Mhm. Yes, that was very helpful. Thank you.
Yeah. Okay. What is one thing you wish every BCBA understood about your role in practice?
Oh, so this is another tough one. I think, BCBAs are really good at, like we talked about, relying on those objective measures and those systematic processes. And OTs really kind of tend to emphasize more on outcomes in natural environments and natural settings. And so um, BCBAs have always been rooted in that evidence based practice, and OTs are getting there. Right? Like that's not where we really started. And that I know just because of the way that BCBAs are trained in the way that they think, that's usually their first go to, right? Is what does the evidence say around this? And so, especially when we talk about sensory processing, we don't have a ton of those peer reviewed journals to go back on compared to the literature that you can find when you're working in BCBAs. And so, I think sometimes that can cause just a like, well, you don't have the evidence based practice, to support this intervention. And so not really open to some of those conversations and communication around like, well, this is why, and trying to understand and seeing what the literature that we do have says and why it's really not always cohesive, and including all the information that may be found when you do research in an ABA setting. So we want to work together as a team. We want to understand your area of expertise and your framework, and how you look through your lens when treating the child, and then we also, would want you to do the same, for us to understand how we look through the lens. Because I think at the end of the day, all we want to see is the child gain independence and make these impactful income outcomes for the family and the child. And so we're all working towards the same goal. We're just doing about it very differently, and there are things that we can. Mesh a little bit. And then there are also things that we have to kind of stay on our own lanes and say, this is under BCBA Code of Ethics and this is under our OT Code of Ethics. And, but we're still working together for that same outcome. And so I think just communication is just such a big piece of this, that when you don't understand what they're doing, to just to ask, like, hey, why are you doing this? Or what are you working on with this skill? Or what goal is being addressed? So that we can just continue to understand each other's professions.
Yeah, I think that sometimes when like OTs and ABAs talk, that's where we get stuck and then we can't move past it, is like this
Mhm.
conversation around evidence-based practices. So I love that you talked about it and said like we're getting there, we're moving in that direction. I think other things that we can do is like we can collect good data, right? Like
Mhm.
we can add really strict recommendations and protocols in place, and we can check to make sure that the protocols were done correctly, and then we can take good data on those things, and then we can make more informed decisions on like, hey, the OT recommended this. we've implemented this and the data, and we've done this for lots of grand rounds. Kiddo, the data indicate that it didn't make a difference on, on the child's behavior or on their attention. And so then we can kind of come back to the drawing board together and collaborate a little bit more. So I think it's good that we kind of address that as like the elephant in the room, but also say like we still have data. Like there are
Yeah.
still ways that we can collect meaningful data. And I was reading an article, been reading a bunch of articles lately about cross collaboration. And that was one of the main things they were talking about is like, write really strict protocols, check treatment integrity, and then look at the outcome data. Make sure your data are accurate, obviously, and then review them. And then have a conversation about like it was impactful and it was meaningful and considered successful or it wasn't. And
Mhm.
everybody needs to agree on what does success look like for that child, which like you said, we all just want this child to succeed. So we need to have the same idea in mind too about what does that look like.
Yeah, that's a really great point, Taylor. BCBAs are such good. You guys are so good at collecting data, and we, as OTs, I think can rely on that data to see, so that we can analyze that and make informed decisions.
Yeah.
Well, Taylor, thank you for this. I think we've had a really great conversation today about OT and BCBA collaboration. I like that we, like I said, shared that experience of starting out together early on and thinking about how things were, um, how many years ago that was and how far we have come. From both professions, to grow individually and then together as a team and really leaning on each other. I think back then we would have been a little shocked to think that there would be a day when, BCBAs would come to OTs and say, hey, I need some sensory strategies for this. And the same, the OTs would come to BCBAs and say, hey, like we're having these maladaptive behaviors and I can't get through my sessions. Can you help me? And so we are really, respecting each other's disciplines and relying on each other's expertise. And I think, it just makes me more excited for the future to see where this goes with collaboration between multiple disciplines.
Yeah, yeah, same thing. I mean, I've really enjoyed our time today. And honestly, when they asked, for us to talk, I was like, oh, this is great. Haley and I have worked
Mhm.
together for literally over a decade, not to age both of us, but and it's just been wonderful to work alongside you. So really glad we were able to spend this time today. As we wrap up, I think like for me, some high points of our conversation today. Number one, I loved like I'm a BCBA at heart. So data, like data driven decisions, data driven collaboration. And really, I think one of the other themes for today was like communication. If they like kept track of how many times we said that today, it was probably a ton, right? We need to increase communication and we need to attempt to understand each other and like what your goals are, like specifically your POC goals. What are the goals for each of your session? What does success look like? And then, communicate those things. And then we also need to just problem solve together. These are the barriers that I'm having. How have you been experiencing that? How are you overcoming that? And then just take good data, right? Be kind
Mhm.
and take good data, as one of my previous mentors always shared. So thank you so much. I'm glad we got to spend this time together. It was great.
Yes, me too. Thanks, Taylor.